At Voluntary Health Scotland, we're continuously striving to foster a community for health creation. That's why we're committed to growing and diversifying our membership, to ensure that we can amplify the voices of our members, showcase their impact, and tell those incredible stories of health creation and health inequalities. And that will form the heart of our strategy in the coming years.
So we'd like to see a change to the wider recognition of impact on health. And obviously for us, arts and culture is a massive area of work and has huge impacts on people's lives in health and well-being, along with a lot of other organisations doing other work, which is not medical or clinical doctors and hospitals, but it is a huge part of health and well-being, and it needs to be in the strategies, it needs to be in policy, it needs to be in pathways. There needs to be a real change, not just in prevention, but actually a move towards prevention.
We need to get serious about addressing the social and economical determinants of health inequalities. Access to good quality healthcare, equitable access is a really important part of the picture, but it's not the only thing. We need to tackle things like poverty, discrimination, stigma, inadequate housing, the whole host of things that make up the 80% of health that isn't formed in the healthcare sector.
So I think for us it's definitely data collection, monitoring, reporting across the whole breast cancer pathway. Currently there's quite a few gaps. One of the main examples is actually with the Scottish breast screening programme. So other than collecting data on your classic sex and deprivation, we're missing a whole range of data on protected characteristics. So that means we don't actually know where kind of those gaps in services are happening and what health inequalities and different groups we're actually needing to address and where these interventions are needed so we can increase uptake of breast screening appointments.
The change I would like to see is a wider scope or wider understanding of health. I think that if we can integrate all the different sort of perspectives of health, looking at social models, community-based models, medical models, if we can integrate all of these to ensure that people are getting the most comprehensive support in their community, I think that that is a vital change we can see by 2035.
As a third sector organisation on the front line of recovery, we have a unique opportunity to shape change over the next decade. Our role is more than compassionate service delivery, it's influence, innovation and lived experience leadership. Scotland's response to drug and alcohol harm must change, and the vital voluntary sector will be critical to leading that change from our communities across Scotland.
The change that Scottish Families wants to see is that families' right to health and right to life is upheld and recognised. We all have the right to health and right to life, but when families are engaging with health services and trying to support their loved ones in terms of their alcohol and drug use, they are excluded and ignored.
In 10 years, I would like to see Scotland where culturally inclusive services are embedded in mainstream provision and ensuring that all communities, regardless of background, have equal access to high quality healthcare and opportunities for well-being.
The change that the Scottish Community Link Worker Network would like to see by 2035 is that community link workers are sustainably funded so that everybody who needs a community link worker has access to one. And I think that's particularly important for Scotland's population health because community link workers are key to the early intervention and prevention agenda and preventing someone going into crisis mode.
I would like the change to be that we are more ambitious for the people of Scotland, because every person living in Scotland, whether they're young and old, deserves the chance for a healthy life. The babies that are born over the next decade should not be impacted by the fact that they're born on one side or another of a health inequalities gap, as so many generations before them have been. So by 2035, I would like to see that Scotland is actually committed firmly to an early intervention health model, where all the decisions at national and local government are looked at through the lens of health inequalities.